I'm here with Tom Topley, and we're looking at a brand new ambulance that Tom's going to tell us all about. And certainly here in Bensalem, and Tom's leadership, Tom Topley's leadership, he's always first and foremost in getting the best equipment. And we have an ambulance here today, Tom. That I want you to tell us about it because I think it's another special one. I know you had the stroke ambulance, and now this is another special ambulance.
This is the first ambulance in Bucks County that's designed for transporting patients with highly infectious diseases. And it's a normal ambulance. We can use it every day. In fact, we do use it on the weekends when we put extra ambulances up. But this ambulance has some really special features in it. After Ebola struck in 2016, Bensalem Rescue Squad became one of 9 rescue squads in all of Pennsylvania that is approved to transport patients suspected of having really infectious diseases from hospital to hospital in the state of Pennsylvania. And we need special equipment from that. We had to do a lot of hazmat training and things like that to help prepare us for that. So if somebody walks into a local hospital and they have a travel history or any suspected contact with somebody with a really bad disease, they're isolated in the hospital, but the local hospital may not be able to handle them, and they have to go to a major hospital, sometimes downtown. We're capable of transporting them, and this ambulance has many things to protect our crews and protect the patients while we're transporting them.
Can we walk around? Maybe you can show us some of the stuff that's out. I noticed the doors are open on the other side.
Sure, and I'd like to say that this ambulance was purchased with CARES money. Part of our COVID needs were we did not have an ambulance that had negative pressure ventilation in it. This actually has the same ventilation that a hospital would have.
Oh, wow.
Where it turns the cab air over and creates a negative pressure in the cab. None of our other ambulances can do that. One of the first things over here on this side of the ambulance is this yellow box. And what this box is, it's a decontamination system, and it plugs right into the side of the ambulance. So after a call, when we have a patient that has a disease or suspected disease, we can close all the doors of the ambulance, and this will spray a chemical disinfectant mist in the whole ambulance and clean the whole ambulance in 6 minutes.
And the cab?
No. So
the cab's separated, right?
One of the things about this ambulance, in Pennsylvania, there has to be a pass-through between the cab and the box. We actually got a waiver from the State Department of Health to have a solid wall there, so the driver compartment. Yep,
right?
driver's compartment's always clean. So there's not a lot to look at in this cabinet, but this box here has those hazmat suits that we wear for contamination, and then all of our full-time employees have these positive air purifying respirators, PAPRs, that you hear about the hospitals wearing. And we got those on a grant this year too. A lot of our equipment this year came from grants. And then this black bag here, you're going to see what's in here because we have a training module. This is called an isopod, and this is actually a patient transport vessel that goes on top of our stretcher. And I'm going to show you that in a second.
Oh my goodness, look at this. That's unbelievable, Tom. Oh my goodness, look at this.
So this is that patient transport vessel that we can use. So the patient would be in a local hospital. They would have their IV started, all their medicines given, and they would be isolated in a room. Well, we can't put the whole room in the back of the ambulance, so we made the room smaller. And this has a port so you can put gloves in to work on the patient. And it's got filters. If you see inside there, there's purple.
Yeah,
They're filters. The air going in and out is filtered to take all the germs out of it. And we can put the patient in here, put him back in the ambulance, and transport him safely to the hospital.
Now, this hasn't put in use yet. It's brand new, am I correct?
Yes, we actually received it in December, but by the time we got the radios and the licensure and everything else done, this is brand new. It's only been in service for about 2 weeks.
And it's ready to go.
And it's ready to go.
Yeah.
Yes.
Yeah. Oh, well, it makes me feel good that we had this kind of equipment here in Bensalem. It's unbelievable. I hope everybody caught that automatically coming down. So You're not jerking people, pulling them out and everything. It's all automatic, right?
Yeah, all us old EMTs have bad shoulders from the way we used to have to put the beds in the truck. And this
Wow.
is a back saver and a career extender.
Wow. Wow. Unbelievable. So this is, it's working here in Bensalem. This is now implemented, right? And in my case, I hope you don't have to use it for them infectious diseases, but they're there, right?
They're out there, and we hope to be prepared to serve any problem in Bensalem. We try to train hard and have equipment to handle any emergency in Bensalem.
Now, would they take them right to a hospital in this?
If somebody goes into one of our local hospitals and has a really bad disease, the hospital would transport them, and this would do the interfacility transport to a large hospital like University of Pennsylvania Hospital.
Wow.
Would be where we would go.
All right, Tom, thank you for showing us here today, and I hope everybody gets to see what they're doing here in Bensalem, our EMS, and it's incredible. And it's a 40th year anniversary, too.
Yes.
That they're celebrating, kind of. So until your next thing, and keep going with what you're doing, we really, really appreciate everything you're doing, Tom.
All right, thank you, sir.